So how do you predict a pandemic? Well, it doesn't start with a supercomputer. It starts 400 years ago.
Yeah, this really modern question, it actually has some surprisingly old roots.
So picture this, not a clean lab, but the grim streets of London during the plague.
Let's dig in. How did just counting the dead lead to a revolution in public health?
This is John Graunt. In 1662, he wasn't a scientist, just a shopkeeper finding patterns in death records.
You know, his simple charts were a huge deal. They basically invented the field of epidemiology.
Okay, so counting deaths is one thing, but what about the actual cost of just being sick?
In the 1940s, we got this idea of years of life lost, a way to measure the impact of dying too young.
Then came the daily. This was a game changer. It measures lost healthy life, not just death.
So it's simple, right? It's the years lost to death plus the years you live being sick.
All right, let's jump to today. The tools we have now, a completely different league.
We went from telling models the rules to letting them figure out the rules straight from the data.
It's like this. AI reads tons of old outbreak stories to guess how the next one will go.
So how did this actually play out during a real crisis, like with COVID-19?
During the pandemic, a bunch of different AIs were basically put in a race to predict the spread.
And we had a clear winner. The random forest model was by far the most accurate.
And this isn't just for pandemics. We're using this tech to fight malaria, rabies, you name it.
So, what's the big takeaway from this 400-year race against disease?
It's this. We've never just been passive victims. It's always been an active fight, confrontation. For ages, germs adapted to us. Now, our tech lets us adapt back, and way faster.
So yeah, from pen and paper to AI, it's been a 400-year sprint of innovation against evolution.
So the tools are getting smarter. But here's the real question. Are we? Thanks for joining this explainer.